AM 1450, FM 99.3 KNSI. Welcome back to another edition of Your Health, produced in association with CentraCare. We have a couple of ladies in studio with us. First of all, Nola Varilek with Community Outreach, Home Health Hospice, and also Jessalyn Middendorf with Benedict Court and Benedict Homes. Let's begin with the fact that, oh my gosh, do we have an aging population or what? And what is CentraCare doing to address that particular situation?
Well, we have a person-first initiative adapting to the ever-changing needs of our seniors. So we offer a continuum of care. So whether it be independent living, assisted living, memory care, we allow them to essentially age in place.
Is that something that we would find out at Benedict Homes or Benedict Court?
Absolutely. So many of our residents, they transition from our independent living Benedict Village to Benedict Court, which is our assisted living 39-unit building. And then we'll transition to our Benedict Homes, a 27-unit building.
Is that sort of the model that we're seeing around not only in Minnesota, but also around the country, that you would have folks who no longer can be in their homes, so they find the place to go where they can get the care they need and then just move up that ladder?
Absolutely. And change is very difficult for anybody. And anytime that you make a move, we all want it to be as smooth as possible. Sure. So by allowing us to offer that continuum within one building, we feel is essential to meeting those needs and helping with that transition. And once somebody is there, a part of the community, they kind of understand the whole path they're going to be walking, don't they? Absolutely. They really understand that, once it is a community, and I like that you brought that up. It is like a neighborhood. It sure is. And it helps them really understand more. It's not as scary now that they understand what the next steps are and that they have services brought to them to help them make every step of the way easy. So I think that people are going to be surprised because chances are good they're going to be moving to a new place, but there's going to be some old friends and neighbors that they may see there, right? We oftentimes have a lot of good old friends that end up meeting up with one another. Nola, I want to ask you about what's going to be coming up out of the annual Expo for seniors. First of all, do I have the location right, or is that going to be somewhere else this time?
You are correct, Bob. The Expo for Seniors is going to be held at the River's Edge Convention Center.
There we go.
Right. On Saturday, August 17th, it's from 8 to noon, and it really is the area's largest expo opportunity for... We bill it for people aged 55 plus. It's really people looking for themselves or for aging parents for a variety of resources. And we're really excited that this year the theme is Scams 101. It's all about prevention, protection, and next steps. And I think that's something that we're hearing about more and more in the news these days. Scams are happening right here in central Minnesota. We're thrilled to have Donna Gregory. She's with the FBI based out of Washington, D.C., who's going to be there, and she's going to be talking about what's happening in the world of scams and how seniors can protect themselves. And then local law enforcement agencies are going to be there as well with a booth where people attending the expo are welcome to come and ask them questions about what's happening locally here in central Minnesota. There are going to be how many vendors? Over 100 vendors with all sorts of support services for the aging population. We will feature housing and healthcare, finance and fitness, travel, just a whole host of things that people will want to know about as they consider next steps in life. Now, how much money should I set aside for tickets to this event? Absolutely nothing, because this is a free event and we even have free breakfast. Nice. Would you appreciate some pre-registration to have a head count for the breakfast? No. The event is free and open to everyone. There's absolutely no pre-registration necessary. The breakfast will begin at 8 a.m. Okay. We always get people coming in early to line up for that, but we do have plenty of food and breakfast is available while quantities last. Here's why this is such an important thing to talk about, folks. Baby boomers, I are one. They are retiring across this country at a rate of 10,000 a day. I mean, that's small cities every single day, isn't it? It is small cities every single day.
Are there particular needs that you guys are seeing that are out there as far as taking care of these seniors? I know that, Jessalyn, you and I talked about the Benedict homes and the Benedict court, but what are some of the other things that people need to keep in mind about making this transition? Things to think about. Let's say somebody maybe is only 55.
I think, Bob, that healthcare systems really across the country are becoming more and more aware of this baby booming, aging population. And probably one of the biggest challenges we have, because I'm a baby boomer too, at the end of that line.
Yep.
And I think it's difficult for baby boomers to sometimes admit that we're reaching that age of being called a senior.
Yes, it is.
I'm not sure how many of us like that, right? And so I think that healthcare systems are really needing to look at how they're delivering care and make changes to meet the needs of those aging baby boomers. So Jessalyn was talking about the housing services and how we have that full continuum of care. But CentraCare is really focused, too, on population health. And what are those things that we can do to protect our aging population?
Prevention.
Absolutely.
Exactly.
All right, I'll tell you what, ladies, we're going to take a break. When we come back, we will pick it up right where we left off. Nola Varilek, our guest, she is with Community Outreach, Home Health Hospice with CentraCare. Also, Jessalyn Middendorf with the St. Benedict Community. We'll be right back. You are listening to Your Health on AM 1450, FM 99.3, KNSI. Welcome back to Your Health, AM 1450, FM 99.3, KNSI. Two guests in studio today. We're talking about seniors, the physical and emotional health for seniors, and the upcoming Senior Expo, which, by the way, is happening August 17th at the River's Edge Convention Center. More information on that in just a moment. But our guests from the St. Benedict community, Jessalyn Middendorf, also Nola Varilek is with Community Outreach for Home Health and Hospice. Ladies, can you talk a little bit about the different types of health concerns when it comes to taking care of seniors? I know there's emotional well-being, there's physical well-being, but also some mental health issues that can pop up as well.
Right. And isolation happens to be one of the top ones. Changing in family dynamics. Family might live far away. Loss of a spouse or friend or neighbor. Depression is often unrecognized as well. So the CDC reports 20% of adults ages 55 or better experience mental health concerns.
When you look at the population of central Minnesota, we don't all live in a city, right? So out in rural areas, I'm sure it gets magnified, doesn't it?
Absolutely. Access to healthcare in rural areas, as we know, is very difficult for anyone, let alone those in our senior population. And
not only in Minnesota, but if we have relatives, in other parts of the country, think about that. Make sure that you're reaching out to these people, talking with them, asking them how things are going. You got to check on folks, the ones that you love, don't you?
Yeah. Every day, just think about somebody that, might not be able to have access to, transportation or just to even get a meal.
Well, what can we do, to help take care of ourselves as far as somebody who is maybe 55, then all of a sudden you wake up one morning and you're 60, and then you're 65, right? The time just flies. We need to really step back, stop and take a look at what's happening out there, don't we?
We do have to stop and take a look at what's happening. I think we need to be aware and keep an eye out. I think it's difficult. My mother lived in another state for a number of years on her own, and it's listening and it's watching and observing. So if families are far-flung and they're coming home for a holiday gathering or a birthday celebration, perhaps, what's happening in the home? Are mom and dad looking like they're doing well? Are there signs?
Right.
Is housekeeping going downhill? Are they clean? Are their clothes clean? Has their weight changed? How is their mental capacity at the time when you're there?
Now, Nola, if I see someone every day, I may not notice those little incremental changes, right? But if
Right.
somebody comes back for Thanksgiving or Christmas or Easter, something like that, those are the folks that are going to notice the greatest
big
amount of
changes.
change, aren't they?
I think for those of us that are close to family and that are seeing them all the time, I think it's encouraging them to become involved. Are they going in for regular checkups and appointments? Are they struggling with knees or hips or shoulders that aren't working as well as they used to, and maybe needing a joint replacement surgery? Sure. I think it's looking for those signs and symptoms and encouraging them to get the care that they need on a more proactive basis.
Sure. We talk
rather
about
than when it
prevention,
gets too late.
right? Prevention. So think about all of these things. Know that this whole aging process, there are certain stages, right, in everyone's life, and we're all going to go through them.
We are. And I think, especially baby boomers, I think we're very proud and we don't like to think that we really are aging. And so do I really need to go in for that annual physical? Do I really need to seek some of those extra support systems that may be in place? We all know those seniors who say, I'm not going to go to the senior center because that's for old people.
Right.
But if we can have some of those emotionally connecting relationships,
Sure.
we're all a better society for it, and people age in place better.
And instead of waiting for a crisis to occur, then it takes away or alleviates some of that emotional stress that families are often experiencing when suddenly they realize, over Christmas, boy, mom really didn't look like she, was okay on her own. And now that they're feeling even more of a stress and a burden. So taking that proactive stance.
And here's something else that people need to keep in mind, right? Medications. Make sure that everybody stays on top of those medications. Something may have changed. When you go to the doctor or when they go to the doctor, your loved one, is it time that somebody goes with them to have the questions all written down? And here's what I'm noticing, doctor, right?
Absolutely. Or when people I see this often from a home care standpoint, people are hospitalized. Maybe they've had a surgery or a medical incident or maybe a joint replacement surgery, and they've been hospitalized. And the doctor and social workers, discharge planners are suggesting that they go home with a little bit of support from home health. And of course, we're proud people. We don't like to think that we need help or support, but having that small amount, a short stay with home health coming in and helping them acclimate to home can prevent rehospitalization and further exacerbation of their illness or injury.
I'm so glad that you brought that up. How do you get through that part? Because nobody wants a stranger coming to their home.
They don't want strangers coming to their home. What I try to do in my work is to help people understand that we're not looking to come in and tell you that you need to move out of your home into somewhere else, a different living arrangement. We're there to help you have those supports, make sure that your home is set up safely. Our goal is to keep you safe and as well as possible and as independent as possible wherever it is you call home.
All right. Can we talk about some of the emotional issues, again, that are facing seniors? Jessalyn, you mentioned, the loss of a spouse. There's that isolation, all of that. If we see something like that is happening, what can we do?
Well, first thing to do is talk about it. Oftentimes, we have people that don't want to talk about how they're feeling or, admit that they might have a mental health need or a diagnosis to be treated. Reach out to a doctor. You mentioned attending appointments with your loved one, and that's very important because that helps the family be on the same page in terms of asking questions and ensuring that an understanding of medication and routines are in place.
And also, I'm sure that there are people listening right now that are saying, yeah, but you know what? I just don't have time for that. Well, you don't have to do it all. Is there another sibling? Is there somebody from church that can help? Right? You can find a partner in all this.
You can find a partner. And sometimes you can find support systems to put in place. So, for instance, you talked a little bit earlier, Bob, about all of these medications that as we age, people tend to take more and more medications for a variety of illnesses or medical events. Something as simple as using a medical alert service CentraCare has this as a available support system for aging loved ones. And they have locked medication dispensers where the medications can be set up in these dispensers. They alarm and unlock so that the loved one can only get to the medications at the particular time that they need to take it. That alleviates a caregiver from needing to come into the home multiple times a day.
Folks, you are listening to Your Health, and we have a couple of special guests in studio with us this morning. Jessalyn Middendorf is with the St. Benedict community, and also Nola Varilek with Community Outreach Home Health Hospice at CentraCare. Ladies, we're going to take a break. When we come back, you mentioned something that I think is very important. Weight loss and eating and exercise and all of those things. How do we know what's going on? Because we are not there. We will get some answers here. AM 1450, FM 99.3, KNSI. It's Your Health. AM 1450, FM 99.3, KNSI. Welcome back to Your Health. Today, we are talking with Jessalyn Middendorf. She is with the St. Benedict community here in St. Cloud, and also Nola Varilek with Community Outreach, that is, Home Health Hospice with CentraCare. Ladies, when someone makes that transition, we've talked about being isolated, whether you're in a rural area or if you've got people, 100 feet away from you in a community somewhere. When you make that transition to a quote-unquote facility, I would think that that's almost like, oh my gosh, I'm back with all my friends. True?
It is. It's a sense of community. Oftentimes people will go knock on their neighbor's door and ask if they want to go play bingo together or go work out in the garden and see what kind of veggies have grown, or sit up on the front of the building and watch cars go by. They realize that they're no longer alone, and it's really not as scary of a transition, especially when it's done proactively versus reactively in a state of crisis.
Well, you are with like people, right? Similar folks. These are my peers. We can talk about the same things. We all love the same things. We live the same things, right?
They're all in the same or similar situation. They have a lot of things that they can relate to and interests that they may not have had that previously.
Independent senior living communities are very vibrant.
It's a lot different than it used to be, isn't it?
Absolutely.
Yeah.
And it really is like living in your own home, but all your friends are right next door.
Sure. It's also interesting to me because people at different stages of their lives are ready to do and live differently. They just may not realize it. You know what I mean? Like, I can't imagine myself living in an assisted living community right now, but I am not 80 years old, 75 years old, 70 years old, whatever.
One of the top things that we hear people say is, I wish I would have moved sooner.
Sooner, yes. How do you do that? How do you bring up that conversation?
It can be a difficult conversation. It really can. But I think once you meet the aging loved one where they are and ask them how things are going where they're at.
Do we take tours?
Currently.
Could we take a tour and maybe see
Anytime.
a friend? That's what I'm thinking.
Absolutely.
Come for lunch, come for dinner, come take a tour.
St. Benedict Senior Community has a variety of programming that the public is available to come out and take part in. So come take part in one of those communities. Come see what it's like, what it's all about. Facilities are beautiful. You can make it be as home-like as you'd like it to be.
Right.
They are comfortable, and they really provide a sense of community and belonging.
One of the most important things, I think, to come out of this conversation is the fact that the 17th Annual Expo for Seniors is coming up again on August 17th. It starts at 8, goes till 12 noon, Rivers Edge Convention Center. What are we going to see when we come to this?
You are going to see over 100 vendors who are providing a whole array of services available in central Minnesota for people who are aging themselves or for their loved ones. And CentraCare alone is going to be featuring the Coburn Cancer Center, the CentraCare Eye Clinic, home health, hospice, and palliative care, all of our senior living communities, rehab, spiritual care, volunteer services, medical alert services, home delivered meals, bone and joint center, and so much more. I mean, it's hard to get it all in 4 hours.
This is really, really a lot, right? A lot for people to process. I think to make it really, really easy, just go to the Expo for Seniors. I mean, you don't have to make a decision that day. That's not what this is all about, is it?
You don't have to make a decision that day, but the beauty of this event is that all of these types of services are available under one roof.
Yeah.
You don't have to take time going to trying to reach out to each of these types of businesses or support services independently. You've got it all right there.
And this is one of the first steps in helping you find out resources within the community. That way, when the time does come, you're feeling like you're better prepared.
Right. You know what, Jessalyn? Get the conversation started.
Absolutely.
Right.
And don't be afraid.
Don't be afraid. We're all getting there. Hopefully, anyway, right?
We are.
Jessalyn Middendorf with St. Benedict Community and also Nola Varilek Community Outreach with Home Health Hospice at CentraCare. Ladies, thank you so much.
Thanks, Bob. It was great.
Thank you.
We'll see you at the Expo.
See you at the Expo.